Good morning.
Morning.
Thank you to my Democratic colleagues for your presence, for your unity, for your strength, and for your leadership. I'm deeply appreciative that we've been joined today by three extraordinary, hardworking American taxpayers, Heather, Jackie, and Jonna, whose lives are being upended by the government shutdown and the Republican health care crisis. And they are here to tell their stories. Donald Trump and Republicans in Congress have shut down the government 15 days ago. And they haven't done a damn thing since to try and reopen it. House Democrats are here, reporting for duty. We are ready, we are willing, and we are able to negotiate a bipartisan spending agreement that actually meets the needs of the American people, reopen the government, and decisively address the Republican health care crisis. But we also need a common sense partner on the other side of the aisle. House Republicans shut the government down. Then they ran out of town. And for the last 3 weeks, they're nowhere to be found. What more can I say? You deserve better. You deserve better. The American people deserve better. House Democrats are fighting to lower the high cost of living. House Democrats are fighting to fix our broken health care system, and House Democrats are fighting to clean up corruption, to deliver a country that actually works for the American people. Donald Trump promised to love and cherish Medicaid. Instead, Republicans enacted the largest cut to Medicaid in American history. That's unacceptable. Republicans falsely claim now to be the party of health care, but their policies are closing hospitals, nursing homes, and community-based health centers all throughout the country. That's unacceptable. The Trump administration is giving $20 billion to bail out a right-wing wannabe dictator in Argentina. But Republicans are unwilling to spend a dime to provide affordable health care to working-class Americans. That's unacceptable. The American people deserve better. You deserve better. It's time to extend the Affordable Care Act tax credits. It's time to prevent tens of millions of Americans from experiencing dramatically increased health care premiums. It's time to make sure that every single American can afford to go see a doctor when they need one. It's time to reopen the government and stand by our hardworking, patriotic federal workers, and it's time to do all of that right now. No further delay. House Republicans need to get back to work. House Democrats are in this fight for working class Americans. We are in this fight for rural America. We are in this fight for urban America. We are in this fight for suburban America. We are in this fight for small town America. We are in this fight for the heartland of America. And we are in this fight for black and brown communities all across America. House Democrats and Senate Democrats are in this fight until we win this fight on behalf of the American people. Cancel the cuts, lower the costs, save health care. It is now my honor to introduce a registered nurse and a principled health care provider from the great state of Connecticut, Heather Broth.
Good morning, Washington, D.C. My name is Heather Broth. I
am a surgical nurse at a small hospital in Norwich, Connecticut, serving patients from both rural and urban communities in the surrounding area. I'm also proud to be the president of our AFT affiliate 5149 in southeastern Connecticut. As healthcare workers, we take pride in giving our patients the very best care because that's what they deserve. We've long struggled with a healthcare system that's strained, which is hard, as it is, but we know it could be even worse. Today I'm here to say that we now are deeply worried that it will be much worse. We know a healthcare crisis is just around the corner because the big, ugly bill law enacted by Republicans in Congress and the Trump White House, it's coming. This partisan law slashed Medicaid and allowed healthcare tax credits to expire for working families, all while funding tax breaks for billionaires. That may be great if you have money, but it's going to make life harder and more expensive for everybody else, including more than 100,000 people in Connecticut who will face higher premiums if the tax credits expire. Already, our small community hospital has had one of the busiest years to date. And with cold and flu season just around the corner, healthcare workers are gearing up for the worst respiratory season we've seen since COVID in 2020. We have a nursing shortage. It currently takes months to see a primary care provider and forget about getting an appointment with a specialist in under 6 to 12 months. We have patients sleeping on stretchers in our emergency rooms overnight and on stretchers in hallways while waiting for other patients to be discharged. Sometimes we count up to 30 patients sleeping on those stretchers. We call those dynamic days. It's clear that the cuts coming down the pike have the capacity to dismantle and destabilize our currently understaffed and struggling healthcare system. Hospitals and clinics will close or cut essential services, forcing patients to travel further and wait longer for care. Up to 15 million people could eventually lose their health care coverage, and millions more will see their health care premiums increase. Our communities can't afford groceries right now. How do we expect them to afford significant rate increases to their health insurance? And we know that rural communities will face higher premium increases than other communities if the health care tax credits are allowed to expire. Nationally, nearly a quarter of farmers and ranchers get health care coverage through plans supported by these tax credits. Entire communities will be devastated if the politicians in charge of Congress and the White House don't take action now. The frontline workers are scared. Everyone who's concerned about their own health or a loved one's health should be as well. Asking our friends and neighbors who can't afford food or rent to pay on average more than double out of pocket for their health insurance premiums is going to force people off their health insurance. That won't stop people from needing emergency care, regardless of whether they live in a blue or red community. Communities will suffer. People will get sicker. It's not at all a stretch to say that some of them are going to die. But instead of working with Democrats to lower health care costs, Republicans shut down the government and took a vacation. Many of our patients are hardworking Americans who are about to receive notice that they're losing the tax credit that allows them to afford health care, and Republicans are okay with that. Republicans control Congress and the White House. They should return here and do their job. They should end this government shutdown and work with Democrats to rescue the health care that's now at risk. Our patients and communities deserve no less. And now it is my pleasure to yield to one of my siblings in this fight, Jackie.
My name is Jacqueline Bush Holcomb, and I am 59 years old. I live in Clark Summit, Pennsylvania, in the northeast part of the state of Pennsylvania. In 2008, my career as a mortgage wholesale lender came to a halt due to the festering mortgage crisis. My husband is self-employed as a certified residential appraiser. When I lost my job, we suddenly no longer had health insurance. We obtained insurance coverage for our family, and we paid for the coverage until our premiums became too expensive to afford. In 2014, I needed emergency surgery, but was denied coverage due to a pre-existing condition. We took money from our savings and paid out of pocket over $6,000 for my surgery. I appealed the cost of my out-of-pocket expense for my surgery and waited for a determination. We continued to drain our savings to pay for our health insurance premiums. While waiting for my appeal determination, our premiums increased dramatically. We were at a point where we could no longer afford health insurance. And then in 2015 came the godsend, the Affordable Care Act. We have received health insurance from the ACA since 2015. I currently work for my husband and his appraisal business. Our income fluctuates due to the real estate market. We update our income for coverage through the ACA accordingly as required. Our annual premium rate fluctuates, and we adjust our budget for coverage as we depend more and more on health insurance as we age. Our premiums are likely to double or even triple next year because of Republican cuts to the ACA. We will not be able to afford this drastic increase, especially since our other costs like food are going up as well. My husband is 62 years old and I am 59 years old. We cannot afford a sudden increase for health insurance, and we will have to go without coverage. We are just one American family.